Hey movers, we just finished chatting it up with Mariana on the beach. She's a physical therapist, and now we're here and at the office. She's about to help me get some control over this neck pain and just to increase my mobility. So let's get to it.
So tell me a little bit what's going on. When did your pain started, and where is your pain, and when do you feel pain?
Well, it started, probably like a month ago. And I just kind of ignored it. I thought it was like maybe my pillow or my mattress. So I didn't think I really needed to see a professional. I tried to do all the home help stuff for myself and none of it worked. And it really it's the worst when I wake up, but like throughout the day, like when I try to look up or, just move certain ways, it's kind of annoying because it's starting to interfere with my like daily life. So yeah, I have trouble like looking up and sometimes turning. And it's really painful in the morning as well.
Okay. When I'm looking down, I'm just making some notes, so I'm paying attention to what you're saying, okay? So it's worse when you wake up in the morning, it's harder to look up and turn. And do you have anything that helps your pain? Anything that you feel better doing?
If I prop a pillow, like when I'm sitting on the couch or something, that kind of helps give me a little bit comfort. Or sometimes I may even put like a heating pad on it to kind of help, but nothing really gets rid of the problem. It just kind of helps it a little bit.
Okay, okay. Where is the pain? It stays just on your neck or it travels and...
Yeah. So when I look up, sometimes it travels. Like I feel like it's traveling when I move, but when I'm just sitting normally, it's in one spot. But it's when I move it, I feel it traveling.
Okay, so it goes up a little bit.
Yes.
Okay. Have you taken any medication?
Yes, I take ibuprofen, but I don't really like to take a lot of medication. So sometimes I just deal with the pain because I don't want to, keep popping pills.
Yeah. Is it the first time that you have neck pain? Have you had it before?
No, I have had back pain, but the neck pain is kind of new for me.
Okay. So I'm going to test a couple movements just to see how is your mobility, when do you feel pain, and then we are going to go from there, okay?
Okay, sounds good.
Okay, first movement. Can you touch your chest with your chin, looking
Okay.
down?
Yes, I can. It feels a little stiff, but I can do it.
Okay, good. Can you look up now as far as you can?
It hurts a little bit when I try to look up. I think this is about where I can go without like being in excruciating pain.
Good. So just try to memorize like a point on the ceiling or something that you
Okay.
see, because then we are going to test a couple movements and
Okay.
then repeat. I just want to know if it's gonna impact in any way your movements.
Okay. So and just
Okay.
keep going up and down.
And the pain is just on your neck right now?
Yes, it's traveling a little bit. Like I said, like when I look up, it travels a little bit, but it's still in the neck area.
Okay, good. Now, can you side bend, trying to touch your ear on your shoulder?
Okay.
Go one more time slowly. Good. And then the other side. Any pain when you do that?
Just a tiny bit. Honestly, it's the worst when I look up. The size is not that bad.
It's fine. Okay. Your mobility looks good when you do the side bending. Now, let's do the rotation. So just try to look as far as you can
Okay.
on both sides.
Just a little bit pain.
It's a little worse when you look to the left side?
Yes.
And then you feel pain on the right, when you look to the left, you feel pain on the right side.
This side isn't that bad, but feel more pain when I start looking this way. The left.
Okay. Okay, so now I'm gonna try a movement with you and we are gonna repeat it and then you just let me know if you feel pain or how does it go, okay?
Okay.
So first, you're gonna tuck your chin straight back as far as you can.
My chin.
Yeah, so you're just going to keep
Okay.
looking forward. Don't tilt your head, just keep looking straight forward and tuck your chin as far as you can and relax. Good. Make sure that when you relax, you don't let your neck go forward. So you're going to go from neutral straight back, always looking forward.
Okay.
And then when you come back, don't let your neck go all the way. You will stop right here and straight back.
Got it.
Good. How does it feel when you repeat this movement?
It's not that bad. The pain's kind of just the same.
Okay.
Yeah.
So let's repeat a
Is
couple
this
times.
supposed to kind of help with the pain?
So yeah, what we expected is once you start repeating the movement, it should become easier and less painful.
Okay.
So let's just repeat a couple times, trying to go as far as you can. And every time you try to move further, so our goal is try to increase your range of motion, your mobility.
Got it.
Relax your neck, your shoulders, and just move straight back. Good.
It gets easier.
It gets easier?
Yes.
Awesome. So now let's add some pressure. So you're gonna go straight back and with one hand pressing your chin. In the end of the movement, you just press back a little bit.
Okay.
You tuck your chin and then press. Good. And remember, always keep looking forward. You're gonna do the double chin. Good. How does it feel when you add pressure? What happens to your pain?
I feel it a little bit more when I add pressure. Yes.
So let's just repeat a couple times and see what happens.
Okay. Double chin.
There we go.
I feel like I'm loosening up. Is
Good.
it supposed to make me feel a little looser?
Yes, that's the idea. So once you start repeating and the pain goes down, I'm gonna add another movement to add some pressure.
Okay. It's
How are you
feeling better. Yeah.
Getting better? Good. So let's add one more exercise. So I'm gonna show you on the side way. So you are going to tuck your chin straight back, and then when you cannot go any further, you are going to look up and come back neutral. Tuck your chin as far as you can. Don't have... Yeah, when you cannot go any further, then from here, you look up.
Okay. Yeah.
Good.
Hurts a little bit.
And come back. Let's do that 10 times and let me know what happens to your pain. The pain cannot get worse. So you start repeating and pay attention to the location of the pain, where the pain is right now, and then what happens when you start to repeat. If it starts to get progressively worse, you let me know.
Okay.
And then look up.
Do I let go and look up?
Yes.
Okay.
Tuck your chin as far as you can. Relax your shoulder, and then from there, look up. So you see, when you're looking up, you do this, and then you relax and do this. I want you to go straight back, and then from here, you look up. So you're not just relaxing here and moving forward before looking up. It's just going back all the way, and then you continue the movement looking up. Good, much better, much better. Let's repeat a couple more times. So tuck your chin all the way, and then look up. Relax your shoulders, open up your chest, and relax your neck, and come back. Remember, when you come back, go neutral. Back to neutral. Okay. Yes, perfect. And look up, relax your neck, open up your chest, going as far as you can. Every repetition, you try to go a little bit further.
The pain is getting better, I can say.
Good, good. That's the goal. So let's just do a couple more times, and then you're gonna retest all the movements. And then look up, relax your neck, let it go, open up your chest. Good. And come back. Is the pain still on the same location?
Yes, but it's not as bad.
Good. Open up your chest, relax your neck, let your head hang, and come back.
And I feel like I can go further.
Awesome, that's the goal, that's it. So let's now retest the movements and see how is your mobility and pain, okay? So let's start bringing your chin to your chest. How does it feel? How is the pain or stiffness in the back of your neck?
Definitely more loose. Yeah, it's not as stiff.
Good. Now looking up. So let's see if you can see any further from the point that you memorized before.
I can see past the third fan, the third fan on the ceiling fan, the third wing. So
good.
I can see further.
It looks a little better. Awesome. And how is the pain when you look up?
It has gone down. It's still there, but it's definitely not as bad as it started.
Good. Let's now do the side bending. How does it feel?
Feels good.
Okay, no pain?
Just a tiny bit, but way better.
Okay, and now the rotation. Trying to look as far as you can. And then other side. How does it feel?
That's much better.
Good, awesome. So now your homework is going to be repeat this movement. So you start with the chin tuck, and then once you can repeat a couple times, and then if you're fine, if the pain is not getting worse and is decreasing, then you progress and add the extension, looking up, okay? So you're going to do that 4 times a day, 10 repetitions each time.
Okay.
And especially on these 2 next days, try to do it right, don't miss it. And pay attention a lot to your posture, because even that the exercise is going to help you and is helping you to improve your mobility and decrease your pain, you have to pay attention to your posture. Because what happens is most of the time we are looking down, and you can look down, just don't let your chest fall. So keep your chest up while you are looking down and pay attention to your posture. So sitting, which is very common, is people relax because they can stand sitting straight for like a long time. And then when they relax, your neck goes forward. And this over time, it starts to give you pain, can pinch a nerve, can give you radiating pain and restrictions on your neck. So just pay attention. Try to avoid this posture. So try to sit as straight as you can. You can even use a lumbar roll to help you to keep your lower back, the curve on your lower back. So that helps your chest to stay up. And then consequently, your neck stays in line. So just pay attention to that while you are sitting, because the posture is going to help you to maintain the progress that you gain with the exercise. So just the exercise alone is not enough. You have to be careful, pay attention to your posture. And also you said that in the morning it hurts more. So just pay attention when you're sleeping in your pillow. Just see if it's not too high or too low. Your head should be like neutral when you are lying on your side. So if it's too low, your neck can put some strain if it's too low or too high. And also when you are lying, see if you are not sleeping with your chin too close to your chest. So that can also create some stiffness. So just pay attention to these details that they can help you. And especially in the morning, when you wake up, the first thing, try to do the exercise sitting to see if it helps with the morning stiffness. Okay?
Okay, that sounds good. And you said 4 times a day, 10.
10. Mm-hmm.
Okay. Had a question. You mentioned something that I could use to help with the posture. Where can I purchase it?
So the lumbar roll, you can purchase on the Mckenzie website. I can give you like the link. And if you don't want to purchase right now, what you can do, roll a towel. You can roll a towel and put like on your back. I have some clients that like to use like a noodle that you use at the pool. So they put like a noodle. So you can adapt with what you have at home. And which is good of the lumbar roll, that it comes with a strap and you can put on your chair so it stays on the same place. And then you don't have to be all the day trying to stay straight because your muscles get tired. So the roll is just when you relax, it's going to help you to keep the posture. So it's just good to have.
Thank you. I know I need to work on my posture. So those are some really good tips, and I'm excited. I will definitely make sure to do my homework. And if I do find that the pain is gone, do I still need to do the homework assignment?
Yeah, so we are going to do that for the next couple days. If you feel that the pain is not decreasing or your mobility is not getting better and something feels wrong, just text me through our message portal and I can help you with that. And let's plan in scheduling a follow-up for next week. So I can reassess, see if how's your mobility, how is your pain, and you let me know any questions or concerns that you have. And if you feel that with the exercise the pain is getting worse, then if the pain is getting worse or you feel your neck more stiff, then you text me, let me know, and then we will stop doing the exercise until we see what's going on. Okay, if everything goes fine as we expected, the pain is decreasing, your mobility is increasing, then you keep doing it until next week on our follow-up visit, and we're going to reassess and we can potentially progress. We have one more exercise that we're going to add to this one that I just showed you. We can progress to make you gain your full range of motion, full mobility on your neck. Okay.
Okay, sounds good. Sounds like a plan. I'll definitely message you if I have any, problems, or maybe even, is it okay if I videotape myself so you can make sure I'm doing it right?
Yeah, sure. I'm going to send you a link for a video that I recorded of the exercise that if you forget the details, you can just access the video, make sure that you're doing it right, and you can record yourself as well. And then if you have any other questions or concerns, just let me know.
All right, thank you so much. I already feel better, so I know by next week during our follow-up, hopefully, I can add on another exercise and just continue to improve my range of motion and pain.
That's the plan. So yeah, just contact me if you need anything, okay?
All righty. Thank you so much, Mariana. That was a great session from Mariana, one of our Viasana physical therapists and owner and founder of VIRT. She did a great job just walking us through some exercises, and so I'm going to go do my homework, and we will see you next time. Don't forget to subscribe to our YouTube channel and follow us on Instagram. I'll talk to y'all later.